Hi, my name is Dr. Selena An, and this is John. How are you?
Good, I'm doing great.
John, did you like going to a dentist as a kid?
I definitely did not. Ever since I was a kid, I always had a hard time getting numb in my teeth. So
Okay.
I would always have to let the dentist know that the normal dosage doesn't work on me. But whenever I would go to the dentist, they would just give me the normal dosage at first, and I would have to tell them that I'm not fully numbed. So it was just a very iterative process where I would tell them I'm not numbed, and then they would give me a little bit more dosage of anesthesia. But it was overall a very painful and long process. So I would say, like, even as a kid, I really hated going to the dentist.
So it must have been pretty traumatic, huh?
Yeah, very traumatic.
What was the most traumatic dental experience for you, John?
I would say the most traumatic experience I had with the dentist was when I was getting my wisdom teeth removed as an adult. So I had an embedded wisdom teeth, which means that my wisdom teeth was underneath my gum. So they
Sideways like this?
Yeah, sideways, exactly. And before going in the procedure, like I do with any dental procedures, I let the dentist know that I don't usually get numbed. But even after I let the dentist know, I still had a very excruciating moment, and it was one of the most painful moments of my life.
So John came to our office not too long ago for tooth extraction and dental implants. And we know that this is not the favorite place for John to be, so we decided to make him a little bit more comfortable and that he feels less pain during the procedure by giving him some IV sedation. So John, how was the experience for you?
It was actually really great. I'm not too sure whether it was the anxiety of going to the dentist that was preventing me to get fully numbed, but when I did the IV sedation, I felt extremely calm. And I just remember waking up from the procedure, and I honestly didn't even think that the procedure has begun because I was anticipating there to be a little bit more pain. I anticipated it for it to be a little bit longer. So when I was woken up, I thought maybe you guys were taking a break, maybe something went wrong with the procedure. And I was just not expecting for the procedure to be so easy, because from my past experience, it has never been that easy.
Right. So those who are not familiar with what IV sedation is, it's actually a very special technique where only 5% of general dentists is trained to do. It is a conscious sedation, so we're not going to completely put you under. However, you're going to be so relaxed that you're going to fall asleep on your own. But you will still be able to breathe on your own, and you'll still be able to listen to our verbal commands. And also, it's super duper safe. We are going to continuously monitor you. We're gonna monitor your blood pressure, your heart rate, your oxygen level, your carbon dioxide level, everything, just to make sure that you are staying healthy and safe during the procedure. So John, I really don't want for you to lose more tooth down the road, but would you consider an IV sedation if you have, future dental treatment like this?
Yeah, so as a patient and as a consumer who's knowledgeable both with the generic anesthesia and the IV anesthesia, I cannot imagine going back to the generic anesthesia when I'm getting a big procedure like getting an implant or a wisdom teeth. And I would actually highly recommend it for everyone, but especially for those people who have anxiety coming to the dentist, or who feel anxious about whether they're going to get numbed or not. I feel like IV sedation is actually a very good option for people like those.